I want to spend a couple minutes to talk to you about potential complications that can happen after a facelift or our Eve lift. Number one, bleeding. This is rare. All these complications are rare to happen, by the way. So bleeding can happen under the skin, between the skin and the smas or the skin and the platysma. So it can accumulate into a hematoma that needs to go back to the procedure room for evacuation. Sometimes it's too small, we just aspirate it. The second complication is infection. Like any other procedure, there's a risk of infection in the face. The risk of infection is really low because the face is extremely well vascularized, but it can still happen. I've seen it a couple times in my entire career, and these are treated with antibiotics. Now, wound healing issues or skin healing issues can happen. Wound healing issues around the incision areas of the face, and these can be treated later on, a 6 month or a year after, with some either lasers, or I might have to go in and just remove the incision and close it again. Skin healing issues involve issues of the healing of the entire skin that have been treated with the Eve lift. So the skin undermining happens here and happens in the neck. So it can be bunching up of skin right here, or it can be some loss of blood supply to the skin. Now, I have never seen this in my practice, but it can happen, and I've seen it in other practices. And if this happens, then it needs a wound healing protocol. Now, smokers are at high risk for this, and I do not offer the procedure to smokers. Smokers are at 12 times high risk of having wound healing issues or skin healing issues. And now, the most important one, which is and this is the one that is extremely rare, is damage to the facial nerve. When the marginal mandibular branch of the facial nerve is one of the most commonly injured motor branch of the facial nerve, and if you smile, the smile becomes asymmetric. Now, I have never seen this in my practice, but I have to tell you about it. It's extremely rare. I haven't seen it in anybody else's practices, honestly, but this is present in every textbook in facelift surgery, and I have to tell you about it. Thank you so much for watching this video.